हेलो अस्सलाम वालेकुम, कैसे हैं आप लोग? उम्मीद है कि आप सब ठीक से खैरियत से होंगे। Today's our topic is hepatitis. So what is hepatitis? First of all, we start from the introduction. The hepatitis is a broad term that means inflammation of the liver. It is most commonly caused by viruses, but also be caused by alcohol, chemicals, autoimmune diseases, and metabolic abnormalities. Hepatitis virus. इसकी etiological factors क्या है? The causes of hepatitis are varied and include viruses, bacteria, and protozoa, as well as drugs and toxins like isoniazid, carbon tetrachloride, and ethanol. The clinical symptoms and course of acute viral hepatitis can be similar regardless of etiology, and determination of a specific cause depends primarily on the use of laboratory tests. What are the types of hepatitis? Hepatitis may be, how it caused. The hepatitis may be caused by at least 5 different causes, viruses. Non-A, non-B hepatitis virus is a term previously used to identify cases of hepatitis not due to the hepatitis A or B. Now we call it hepatitis C. With the discovery of the hepatitis virus C, E, and G, virtually all the viral etiologies of non-A and non-B disease can be specifically identified. Other viruses such as Epstein-Barr viruses and cytomegalovirus can also cause inflammation of the liver, but hepatitis is not the primary disease caused by them. So first of all, we go to the hepatitis A virus. What is hepatitis A virus? It's an unenveloped single-strand RNA virus with cubic symmetry. Hepatitis A virus is classified in a separate genus like hepatoviruses of a picornavirus. How it transmits? It is spread by the fecal-oral route, and outbreaks may be associated with the contaminated food or water. So, how it works? Pathogenesis and clinical manifestations. The virus is believed to replicate initially in the enteric mucosa. The multiplication in the intestine is followed by a period of viremia, which is spread to the liver. The response to replication in the liver consists of lymphoid cell infiltration. There is a necrosis of liver parenchymal hepatocyte cells, and there also a proliferation of Kupffer cells. The extent of necrosis often coincides with the severity of the disease. It can be demonstrated in the feces for 10 to 14 days before the onset of disease. In most patients with symptoms of disease, virus is no longer found in fecal specimen, and contagious is greatest 10 to 14 days before symptoms appear. In hepatitis A virus, the infection and incubation period of 10 to 50 days is usually followed by onset of fever, anorexia, poor appetite, pain in right abdominal quadrant, upper abdominal quadrant, nausea, and within several days, jaundice. The liver becomes enlarged and tender. Serum aminotransferase and bilirubin levels are elevated as a result of hepatic inflammation and damage, and the recovery occurs in days to weeks. What about the late diagnosis? The antibody to the hepatitis A virus can be detected during early illness, and most patients with symptoms and signs of hepatitis A already have detectable antibody in the serum. Early antibody responses are predominantly immunoglobulin G, which can be detected for several weeks or months during convalescence. Antibody of the immunoglobulin G class predominates. So now we move on to the hepatitis B virus. The hepatitis B virus is an enveloped DNA virus belonging to the family Hepatitidinae. The complete virion is a spherical particle that consists of an envelope around a core. The core comprises a nucleocapsid that contains the DNA genome. The other components of the core are hepatitis B, uh, are contagious, and the hepatitis B E antigen, which is a low molecular weight glycoprotein. The envelope of the virus contains the hepatitis B surface antigen. So how to transmit? It has become clear that the major mode of transmission is through close personal contact with body fluids of the infected individuals. Hepatitis B surface antigen has been found in most body fluids, includes saliva, semen, and cervical secretions. Under experimental condition, as little as 0.0001 ml of infectious blood has produced infection. Means this amount of fluid or secretion is enough to produce the infection. The transmission is therefore possible by vehicles such as inadequately sterilized hypodermic needles or instruments used in tattooing and ear piercing. So, what is the mechanism of hepatitis B disease? The pathogenesis or the clinical manifestation. The clinical picture of the hepatitis B is highly variable. The incubation period may be as brief as 7 days or as long as 160 days. The liver injury appears to occur from a cell-mediated immune system attack on hepatitis B virus. The viral antigens on the surface of infected hepatocytes are targets for cytotoxic cells. The immune complex of the antibody and hepatitis B surface antigen can deposit in the tissue and activate the immune system, resulting in the arthritis as well as skin and kidney damage. While the patient who have the AIDS and who have malnutrition or having chronic illness, they doesn't have a powerful immune system, so they become carrier or asymptomatic. The hepatitis B virus can cause acute and chronic hepatitis. The acute hepatitis is the fulminant hepatitis, the severe acute hepatitis with rapid destruction of the liver. Number 3 is the chronic hepatitis, which may be asymptomatic carrier, chronic persistent hepatitis, and chronic active hepatitis. Asymptomatic carrier क्या होगा? The carrier patient never develops antibodies against hepatitis B surface antigen and harbors the virus without liver injury. There are an estimated 200 million carriers of hepatitis B virus in the world. Chronic persistent hepatitis, what occurs in it? The patient has a low-grade small green hepatitis, while in chronic active hepatitis, the patient has an acute hepatitis state that continues without the normal recovery, lasts longer than the 6 to 12 months. The acute hepatitis B is usually manifested by the gradual onset of fatigue, loss of appetite, nausea, pain, fullness in the right upper abdominal quadrant. And with the increased involvement of the liver, there is the increased cholestasis, hence the clear color stools, darkening of the urine, and jaundice occurs. So, what will the complications? The primary hepatocellular carcinoma and the cirrhosis. Cirrhosis infection with the hepatitis B virus result in permanent liver scarring and loss of hepatocytes. While in primary hepatocellular carcinoma with chronic infection, The hepatitis B virus DNA becomes incorporated into the hepatocyte DNA and triggers malignant growth. There is a 200-time increase in the risk of development primary hepatocellular carcinoma in hepatitis B virus carriers. The carriers जो होंगे उसमें 200 times increased risk होगा hepatocellular carcinoma बनाने में as compared to non-carriers. So what will be the lab diagnosis? So hepatitis B surface antigen. The presence of surface antigen always means there is a live virus and infection, either acute, chronic, or carrier. When anti-hepatitis B surface antigen develops, the hepatitis B surface antigen disappears and the patient is protected and become immune. Second one is the hepatitis B surface antigen means a disease, chronic or maybe acute. The anti-hepatitis B surface antigen means the patient may be immune, cure, or no active disease. What happens in hepatitis core antigen? When antibodies to hepatitis core antigen are not protective, but we can use them to understand how long the infection has been ongoing. With acute illness, we will see immunoglobulin M, anti-hepatitis B core antigen, and with chronic or resolving infection, immunoglobulin G anti-hepatitis B core antigen will develop. So, what does it mean when immunoglobulin M anti-hepatitis B core antigen? It means it shows the new infection. And when the immunoglobulin G anti-hepatitis B core antigen appears, it indicates the old infection. Lab diagnosis में और क्या आ जाएगा hepatitis B E antigen. The presence of E antigen denotes a high infectivity and active disease. The presence of anti-hepatitis B E antigen suggests lower infectivity. Hepatitis B E antigen, high infectivity, virus going white. While anti-hepatitis B E antigen, it means it becomes low infectivity. What will be the prevention? To save sex practice, avoidance of needle restricts injuries or injection, drugs use are approaches to diminish the risk of hepatitis B infection, serological tests on the donor blood to remove hepatitis B virus contaminated blood from the donor pool. And hepatitis B vaccine is now given to all infants at birth, 2, 4, and 15 months. Active immunization, the vaccine is a recombinant vaccine. The gene coding for hepatitis B essentially is cloned in yeast and used to produce mass quantities of hepatitis surface antigen used as a vaccine. The administration of hepatitis B immunoglobulin G soon after the exposure to the virus greatly reduces the development of symptomatic disease, and the post-exposure prophylaxis with hepatitis B immunoglobulin G should be followed by active immunization with vaccine. So, what comes next is the delta hepatitis or hepatitis D. Hepatitis D is found only in hepatitis B infected person. The hepatitis D virus uses hepatitis surface antigen for assembly. Hepatitis D virus is a small single-stranded RNA virus with helical nucleocapsid. Infection occurs in two ways. The co-infection with hepatitis B virus and hepatitis D virus both are transmitted together parenterally through IV drug use, blood transfusion, sexual contacts. They can cause acute hepatitis similar to the caused by hepatitis B virus. The antibodies to hepatitis B surface antigen will be protective against both, ending the infection. Superinfection means when hepatitis D virus infects a person who has chronic hepatitis B virus infection already. This results in acute hepatitis in a patient already chronically infected with hepatitis B virus. This hepatitis B virus infection is often severe with a high incidence of fulminant hepatitis, cirrhosis, and a greater mortality of 5 to 15%. Diagnosis is made mostly by demonstrating immunoglobulin M or immunoglobulin G antibodies of both to the delta antigen in the serum, and the immunoglobulin M antibodies appears within 3 weeks of infection and persist for several weeks. The immunoglobulin G antibodies persist for years. Now comes the hepatitis C virus, which is an RNA virus in the flavivirus family. These are at least 6 major genotypes with multiple subtypes. The genotypes have different geographic distribution and may be associated with different severity of disease as well as response to therapy. Hepatitis C is an insidious disease in that it doesn't usually cause a clinically evident acute illness. It was manifest maybe the presence of swollen chronic hepatitis that may ultimately lead to the liver failure. The transmission is less well understood than for hepatitis A, B, and D. The transmission of hepatitis C by blood is well documented indeed until screening blood for transfusion was introduced. It caused the great majority of cases of post-transfusion hepatitis. It may be sexually transmitted, but to much less degree than hepatitis B. Needle sharing is also a cause. The incubation period of hepatitis C averages is 6 to 12 weeks. Infection is usually asymptomatic or mild but results in a chronic carrier state in up to 85% of adults of patients. Average time from infection to the development of chronic hepatitis is 10 to 18 years. Cirrhosis and hepatocellular carcinoma are late sequelae of the chronic hepatitis. The lab diagnosis for the hepatitis C, the antigens of hepatitis C are not detectable in the blood. So diagnostic tests attempt to demonstrate antibody. The antibody response in acute disease remains negative for 1 to 3 weeks after clinical onset and may never become positive in up to 20% of patients with acute resolving disease. Now, the hepatitis C. The hepatitis E is a small single-strain, non-enveloped RNA virus, similar to but distinct from the Calici viruses. The transmission is by fecal oral route. Outbreaks occur after contamination of water, supplies, or food, and it usually causes self-limiting hepatitis of varying severity. Diagnosis is by immunoglobulin G or NAT. The infection is prevented by hygiene measures. Thank you. That's for all for the today. So, did you get the last lecture of the jaundice? Please give your response in written. Hello, student. So, are you listening to me?
This severe atresia is classified by 1 to 3. Restricted to the common diagnosis. It is type 1 biliary atresia. If atresia of common hepatic disease, there is type 2 and right.
हेलो बेटा आवाज आ रही है आपको?
यस मैम।
बेटा आपको पिछले हफ्ते का लेक्चर मिल गया था जॉन्डिस का? जी बेटा, आप लोगों को पिछले हफ्ते का लेक्चर मिल गया है या मैं अभी भेज दूँ?
Hepatitis number 6. Malformation of the GI tract, GI tract.
Are you getting me?
Hepatitis number 6.
Hello.
Are on the right side of the hepatitis number 6 are and other that are not based in the positions
बेटा आवाज आ रही है तो प्लीज अपना रिस्पॉन्स दें.
clinical feature are patients of hearing ulceration, whatever the cause is.
Yes, ma'am.
आपके पास आवाज कंटिन्यूस नहीं आ रही है मेरी?
In ear atresia, patient in first week of birth with the progress initially mild jaundice.
ओके, so that's all for today. मैं आपको ये लेक्चर भी भेज देती हूँ. अगर किसी को पिछले वाला नहीं मिला है तो प्लीज वो भी कमेंट करके बता दे ताकि मैं उसे भेज सकूँ. ठीक है बेटा, थैंक यू फॉर टुडे. अल्लाह हाफिज.
Findings of the obstetric are direct. Total is raised and outreach direct part is more raised. Line first is also raised. Okay, so we diagnose it. We suspect then there is a direct. Usually suspected which may be advised.
लास्ट वाला लेक्चर का लेक्चर ऑन छोकरन के देखो थोड़ा नेट जो प्रॉब्लम है सीटी बता दी नहीं उन्हन के
मां उनके जेके हुई उनके ॾेई छॾी. अगर सेव थी वई त मां उनखे करे ॾेई छॾी.
अच्छा हां पोइ हीअ बि ॾेई छॾियो.
हां मां उनखे इयर मां करे छॾी.